Welcome to the Reprofiles, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Reprofiles.
Infertility, injustice, and all things nobody warned you about. Hi, Reprofiles listeners. This is Anne Marie. I am coming to you by myself. So Elizabeth is out doing her thing, running for Congress. I have her little picture up here. If you're watching on YouTube, I have her picture behind me so that she is here in spirit, but she's not here in voice or person. So she apologizes for that. She's going to miss you all, but we are still going to move forward with our weekly edition of the Reprofiles. This is our first episode since the new year. We've been enjoying our holidays, just kind of relaxing a little bit. Thought the new year was going to bring good things. We actually both want to get a refund on 2026 already. We're already ready to go back, but here we are. So we're going to talk a little bit about this past year, things that have happened in 2025, and things that we're looking forward to in 2026. So I like to say 2025, a retrospective, and 2026, a new hope. Now, anybody that knows me, I'm a gigantic nerd. So that is a Star Wars reference. So let's get on with it. 2025. It was a very loud year for people in the reproductive health area. It was a very loud year for IVF. In some ways, I think that it's a good thing that a lot of things came out in the news. People were more aware of what IVF is. You know, people were fighting for that. People were coming out behind the curtains to talk about it. And I think that's a good thing about having a loud year in reproductive health is that we're able to get out and talk about things. It was a lot of news. I really wanted a break from it, the news that is, but advocacy, like ovaries and IVF, don't take breaks. So here we are. Elizabeth and I, we are still going to keep advocating like we always do, always fighting, moving forward thing. Everything is going to be moving forward. All right, so the beginning of 2025 ushered in a new era of a new presidency. That was in January. And in February of 2025, on February 18th, President Trump signed an executive order to get policy recommendations for how to protect IVF access and to reduce costs. Now, remember that was in February 18th, 2025. And I remember thinking at the time, well, you know what? Maybe this is a really good thing. This is at least we're doing something. We're planning something. We're thinking about things. So this is this is good. And that's where I kind of leave the early part of the year, February, with a little bit of hope. Some other news that happened, and I'm going to kind of go in an order here of the months. So in March, the U.S. government froze tens of millions of Title X family planning funds, impacting clinics that provide contraception, cancer screenings, and STI services, particularly for low-income patients. So this all came down at the end of March. So just to give you an idea that these grants were all 13 directed awards to Planned Parenthood affiliates, obviously a critical provider of comprehensive sexual and reproductive health care, that are continuously being targeted from the anti-abortion movement. I think we've said this very clearly many times this past year. Planned Parenthood is not just an abortion clinic. They provide reproductive health for a very diverse group of people, and different, aspects of reproductive health, from contraception to doing gynecological care, pap smears, things like that. These are all very important. Taking away or defunding these parts of the Planned Parenthood, that's very unacceptable. A lot of people are going to lose care. They're not going to be able to get that care elsewhere. They're not going to be able to find an OBGYN in their area to take care of them. They may not have insurance, so they may not be able to afford that as well. So that was happening like in March time. In April, we had National Infertility Awareness Week is always in April. And I tried to do my part of National Infertility Awareness Week, which was I reached out to the city of Orlando, the city beautiful, to get lights changed to orange for a day during a National Infertility Awareness Week. They said we set up the day. It didn't happen, but luckily, I did have a clinic that came out and joined me in celebrating National Infertility Awareness Week. We took some pictures. We were able to kind of chat a little bit. Chatting with the community, I think, is important. Not just meeting with patients, but also as a community of fertility specialists locally. But I only had one clinic that came out and visited me, and that's okay. It's better than zero. So I'll take it. Little peeved that the lights never changed color to orange, and I even stayed later in the night and they never changed. So that was a little disappointing from the city, but that's okay. We move on. So that was my part of National Infertility Awareness Week. Of course, I wore orange. I posted on LinkedIn and Instagram and things like that just to promote awareness that we all should be aware of what people have to go through during their infertility journey. So, the other thing that was happening around that same time is federal fertility and maternal health monitoring programs were significantly scaled back, raising concerns about long term data tracking and support for maternal health disparities and fertility care. This is very important to be following, particularly with maternal health disparities. It is well known that there are GYN deserts out there, OBGYN deserts out there. Hospitals are closing their OB units, they're closing their birthing centers. So, for people who want to deliver, sometimes they have to travel hours to get to a hospital that they can deliver at. So, it's very important to watch that because who's watching out for these women while they're pregnant? Who's watching out for their blood pressure and preeclampsia and things like that? How often are they seeing an OBGYN? These are all important things that need to be addressed. The CDC, their CDC's division of the reproductive health, which studies maternal health, appears to have been eliminated at this point of the year. And, why? Why I think that we called it Doge, more like Dodge at the time, but people were being let go left and right, and these are important topics to study. So, as we continued through 2025, in May, a pretty terrible event happened in May, and that was the fertility clinic bombing in Palm Springs. You might not have remembered this, or maybe you did. It feels like a million years ago, but at the same time, it feels like it happened yesterday. So there was a gentleman who did a car bombing at a California fertility clinic. Injured several people. None of the embryos were affected. No patients were affected, thank goodness. This gentleman, he was 25 years old. And this is where we all kind of started learning about what anti pro life or an anti natalist is. Like, basically, they believe that life is meaningless. They believe that it's morally wrong or unjustified to procreate, to have children, believing that bringing new life into existence causes more harm than good, and that there will be inevitable suffering, pain, non-consensual nature of birth. It's a very kind of outskirts type of thinking, but it's out there, and we should probably be addressing and notified that people, if they're following these type of social media accounts, these are concerning to think about. So we're also in May. So remember, I talked about that February 18th executive order. So the expiration date for that February 18th executive order expired on May 19th, 2025 at midnight. The very next day, May 20th, was Federal Advocacy Day. So that's a day that we come as a community, the infertility and fertility people, we come together, we meet with congressional members, and we ask for their support in infertility access. Federal Advocacy Day is sponsored by Resolve, the National Infertility Association, and ASRM, the American Society for Reproductive Medicine, which I am a member of both, and Elizabeth is as well. And we both were on with our Congress people, and we met with them or their representatives if they were not available. We hail from states that are, red. The responses that I got from my state, and my state is in the state of Florida, they been very polite. People are like, okay, okay. I had one congressperson who was actually quite rude to one of the patients that I invited to come on and join Federal Advocacy Day. I invited her to come on. I said it's not that bad. It's actually kind of, we're all going to be there to support you and we're all going to be listening to you. You're not on your own. And she told her story, and the congressman was basically like, okay, and kind of walked off the screen. And he had other things to do. This was one of his constituents. This wasn't just any of us. I am not a constituent of his area, and he did not want to talk to anybody who was outside of his area. And so we had one person, and she told her story, and it's a pretty gripping story. And he basically kind of blew her off, and I didn't think that was very nice. So we all got off. Once that call ended, we kind of were all like, wow, that's crazy. But you know what? That's what we're up against sometimes. But I encourage everybody who has a story through infertility, please share your story if you can or if you feel like it. You don't have to, but it is good to share your story, because your story is going to make the difference. Not me as a fertility nurse saying, oh, I had a patient once that had this. That doesn't carry as much weight as your own story. So I do encourage people to get out there and share their stories, particularly with the Congress people, because they're ultimately the ones that are going to be making decisions about access. They're going to be making decisions about what needs to be covered, mandates, things like that. That's May. So then we move on into the mid-year. There are, multiple state legislators throughout the year that continue to introduce bills of personhood language. Basically, that could criminalize aspects of pregnancy outcomes, expand liability against abortion support networks. But also, the thing with the personhood is it affects IVF. So many of these state legislators, that when they say personhood, that means a fertilized egg is a person. So how does that work with IVF, right? We create embryos, we fertilize embryos, let them go to the blastocyst stage embryo, and then they are frozen or they are transferred. Now, for many people, they have what we call leftover embryos. They are cryopreserved, they are in stasis for as long as they want. When they're ready to come back for another child or another chance, perhaps a transfer didn't work and they come back, then they have a frozen embryo that they can thaw and do another transfer, have another child, expand their family. But with these personhood laws, many times what happens is that the bills are going to criminalize if the embryo, for example, doesn't survive a thaw. Now, who's at fault? Is it the embryologist? Is it the reproductive endocrinologist? Who is going to be liable for that? When I went through training for doing fertility nursing, it was always told to me, embryos are a chance for life. It's not life, it's a chance for life. It's a potential for life, not a person that does not have rights. And it should be up to the person or the couple, whoever has created the embryos, to decide, I am going to do a transfer, I am not going to do a transfer, or if they plan to discard their embryos. So these are the type of things that we're up against multiple times this year in multiple states. So that's just one aspect of the personhood. The other part is, of course, the abortion. Of 2025, 13 states had a total abortion ban. 28 additional states ban abortions somewhere between 6 weeks and viability. Typically, viability is up to 24 weeks. So that's where we stand on that aspect right now. So July, I think, was kind of quiet. I'm not going to lie. I really couldn't find much news or remember much news from July. So August, though, exciting news. The Reprofiles begins. Our first episode was in August. So yay. So the Reprofiles began because Elizabeth and I met in an advocacy group primed through ASRM. And our conversations were such that we were like, we should really just do a podcast because our conversations could be a podcast. So why don't we just do that? Because everybody and their mother has a podcast. So let's just do it. Now, everybody and their mother and every single celebrity and their mother has a podcast, but I tend to think I like mine. We always joked, even if nobody listens, we're still going to do it because it's just a conversation between the two of us. We do a little bit of research, we talk about things, and, it's going to be out there. Hopefully, it's being broadcast to outer space and, maybe aliens will hear us talking. I don't know. So, September comes in. And one of the things it shows is that 82% of US women worry about encountering reproductive health misinformation online. So there's a big gap between the public understanding of fertility, contraception, menstrual cycles. I mean, we see it all the time, right? It's on TikTok, it's on Instagram, Facebook, LinkedIn, wherever you go, you're going to find misinformation. There's so many times that I hear patients or clients of mine and they talk about, oh, well, I saw this thing on TikTok. And I'm like, oh God. Now, that's usually what my first response in my head is. But I'm like, okay, tell me about it. And I'm like, yeah, that doesn't make any sense. So let me tell you why. And I try to tell people, well, not everything is true. Not every supplement that you have to do. And for a lot of people, they just need to know that they're doing the most that they can to get the best outcome. And I believe in that. If it's not going to hurt the cycle, if it's not going to hurt, any aspect of the doctor's, plan, I'm like, fine, you can try it. But there are certain things out there that I'm just like, come on, man. Come on, let's go. This is not working. This is just made up stuff. I can make stuff up that's better than that. So, always share with your fertility nurse or your doctor and ask them questions. Don't be afraid to ask questions. And never, never, never say, I know this is a stupid question. Never say that because there is no stupid questions. You just don't know. You don't know what you don't know. That's why we're here. And that's why I started my own business. That's why um, I am out there advocating for people because I want knowledge to be out there. The other thing that happened in September is Elizabeth went to Washington, D.C. So that's very big. She went there as part of the Primed 2 program, and she was able to go on the Hill and advocate for you. And she talked to different Congress people with the group, which is amazing. I did it last year. She unfortunately couldn't make it due to illness, and she was able to go this year. And she was able to do all her advocating in that year. And hopefully that will be her new second home after her election later this year. So, we'll say good luck on that part because we really want her there to be our advocate and be able to actually vote on bills. So in October is LGBTQ community Pride Month. We talked about that on our podcast. We celebrate that with many friends of ours. And, it's something that's very important to me because I've seen the impact of people that are going through many struggles coming out or, just telling people it's 2025. Why do we keep having to have these constant conversations of people being kicked out of their homes by their parents or, not having the parents understand them? That's what really affects me. On October 16th, there's a surprising announcement that is made. So, get this. On October 16th, two things came out of this administration. New federal guidance to allow supplemental pre-tax insurance plans that cover fertility treatments. Yay! And number two, EMD Serono, which is a pharmaceutical company that creates some fertility medications, will offer discounts of up to 73% on their fertility medications, specifically Gonal-f, Cetrotide, and Ovidrel, through a collaboration with Trump RX. So now, Trump RX is supposed to start in January of 2026. We are in January 2026, and I haven't heard anything since that October 16th announcement. So I'm happy for the announcement. I was actually very surprised. That's why I said it was a surprising announcement. I was surprised. I was like, wow, okay. Things are happening. Even though they started back in February, things are actually happening. But it is January of 2026, and we still don't have anything yet. No clarity on that. So not really sure where we are on that. So also in October, there was a lot of state legislators that there's a lot of wide range of bills that wanted to like undermine contraceptive access and rolling back access to certain types of contraception. Again, we're going back to a personhood type of thing, which would eliminate let's see, access to IUDs, certain IUDs. That was one of them that I saw in one of the states. So, these are things that we are on our radar that we need to talk about. Not everybody knows about because it may not be in their state. But states tend to follow other states and then they might be coming to your state. So let's just keep focus on making sure everybody has access to different types of contraception because they have every right to that health care. The other thing that happened in October was we had our ASRM Congress in San Antonio. So that was nice. My first time to San Antonio. Did I go to the Alamo? Yes, I did. Being that I've seen Pee Wee Herman's Big Adventure so many times, yeah, of course I had to go. So I went. It was fine. It was a fine afternoon. Doesn't take very long to go through, but it was there. I went there. I saw it. I'm a big history person, so that was good. The Congress was actually really good as well. I presented. I think it went okay. I don't know. I always doubt myself after I present, so I don't know how it went. I think it went well. My partners were amazing. I was just kind of average, I think. That's just me. Everybody, look at here. I'm struggling here, doing this on my own, but I'm just going to keep on talking and you're going to keep on listening. Well, at least I hope you're keep on listening. It's just weird not having someone to banter with. It's not weird not having someone to bounce things off of because that's what I like to do. So I'm bantering with myself. Not so much. So we're moving through the year in November. It was shown that telehealth provided abortions in the US rose 27%. Excuse me, rose to 27%. 27% of all abortions were done by telehealth, reflecting the continued importance of remote care in states with restrictions. So, for example, I live in the state of Florida, as we all know, and the closest state that anybody would need to go to, I think, is North Carolina now. So people who are unable to travel, being able to do a telehealth consultation to get medications is one thing. Many states are not allowing, the mailing of these medications to them. So they have to travel. When I worked at Planned Parenthood, it was when the 6-week ban came into effect. So, we had to kind of work with other states like, hey, do you have family that lives in X state? Or can you get travel to this particular state and to have access to care? I found it very interesting that telehealth actually rose a lot during that time, which is good so that people don't have to travel. Because if you live in South Florida, driving all the way to North Carolina, that's a long drive. So in December, Meta, the social media people, removed or restricted over 50 global accounts tied to abortion advice and queer reproductive health information. So that's kind of a red flag to me about digital access to vital health resources. Like, why are they picking that? It is their ideology? Is it that's what they believe and they don't want it on their site? There's many things on Meta sites that I see that I'm like, I don't know if that's appropriate. And I don't think that they should be, nitpicking on certain sites unless it's, very, I guess, disruptive. Is it disruptive? Is healthcare disruptive? I don't think so. That's just my thought. Also, the other thing that happened in December is the NDCC. That was the loss of IVF for military families, that is provided by Representative Johnson, the speaker, basically took it out of the military bill. He didn't want it. He just thought to himself that he didn't want it, so he pulled it out of the bill. So no IVF for military families. So thank you for your service, and you can't have a family on your own. So I've been kind of a downer, Debbie Downer, on this podcast in a way. Sorry, 2025 wasn't great for me personally, but it was quite the year of reproductive health. So maybe I can end a little bit on a bit of hope because we are a new hope, and I'm hoping that the new year will bring forth new thoughts. So, one of the things that happened in January that is good, and I like to call it California dreaming, but the senator in the state of California was able to get past the Senate Bill 729, which requires state regulated large employer health insurance to cover diagnosis and treatment of infertility, including IVF. And that goes into effect for contracts issued or renewed on or after January 1st, 2026. However, they're not required to comply until July 1st of 2027. So there is going to be a gap. People are going to think, oh, yeah, I have IVF. It's January of 2026. No, not necessarily. It just depends on your plan and your company. But the good news is it's happening. They also changed the definition for infertility to be inclusive of the LGBT plus community and, kind of models it after the ASRM or the American Society for Reproductive Medicine's definition. That's all good news. Also in California, when we talk about large group healthcare plans, it's for our 100 or more employees. Things are looking up. Things are looking good for people who may or may not have had access to have coverage, and they don't have to go putting second mortgages on their house to provide for IVF. They don't have to make candles. They don't have to upgrade furniture and resell it. These are the things that patients do nowadays. Take out huge loans, crowdfunding, all of these things that patients have to do. But in the state of California coming up, won't have to do that. I used to live in New Jersey and I didn't have, we lived in a mandated state. It was great. People had coverage. It was a lot cleaner, meaning that it was easier to deal with than coming to a non mandated state, which is what I live in now. So it was a little difficult. So there's that. Okay. So we got that going for us now. So, you know, I know articles and news in general, they focus on the sensationalism, like what's going to get the biggest clicks? What's going to get the most views? So I try not to let the lack of good news um deter me from thinking positively. There are so many ways out there that are trying and changing the world. So many people who are trying or changing the world. People are actually fighting back on these blanket laws that might hurt abortion, but they actually harm real people who are in need of care. We are starting to hear more stories of people having to travel long distances to get that health care. People are starting to call for changes. They are starting to call for not these blanket laws, not these very restrictive laws. They're calling for changes. Yes, there is a faction who believe that abortion should be illegal, that contraception should be banned, that women should stay home, but guess what? It's not real life. And people are seeing through that. Women who are facing miscarriages have to travel for their care. Their stories are out there. Women who rely on contraceptive to be able to function, their stories are out there. Women who have endometriosis, they rely on contraception to help them get through the painful periods of endometriosis. For those who have PCOS, these are ways to control their cycle. All of these people's stories are out there. Women who died while pregnant or after pregnancy, their stories are out there because they didn't get prenatal care or proper prenatal care, or doctors weren't listening, or nurses weren't listening. Women who know, they know not everybody can stay home. Not everybody can tend to the hearth and home. It just is not possible in this day and age for everybody to do that. Their stories are out there too. There is a faction that are calling out the real issues. Affordable healthcare, affordable childcare, maternity and paternity leave policies, that we need to basically we need to leave the 1960s and the 1960s. This is 2026 and we need to move forward. Not everybody wants a family and they shouldn't be made to feel guilty about not having a family. There are people out there who admit they would not be a good parent. Okay, don't be a don't be a parent. They don't want to be. And that's okay. Everybody's able to have that own opinion. And there are people who are desperate to be parents and they cannot. And we want to be able to provide them with healthcare, with access to that healthcare so they are able to have a family if they'd like. So we are here. Well, I'm here. And Elizabeth is in spirit. But we are here to tell you that we will be here all year long. We're going to be bringing attention to reproductive health concerns, successes, failures, we always like to say we like to pull back the curtain and we show it to all to you, not just the warm and fuzzy, happy, happy, joy, joy stories that we've seen in fertility clinics, but all that seedy underbelly and the things that you need to know that need to be exposed about our field as well. And do you want to talk about something that we haven't talked about yet? Let us know. We are open to talking about different things. We are going to have some guests coming up talking about different topics, but we want to hear from you guys. What are some things that you are concerned about? What are the things that, we haven't talked about that you're like, "Oh, let's talk about this," But, I'm still kind of high on that New Year's buzz because I really just want to leave this place better than when I was here. I want to leave this world better than when I had it here. So here's to a new hope and to a new year. I know 2026 hasn't really started off very well. There's been a lot of news of different things. I'm not going to talk about them because we're talking about reproductive health right now. But there are things that are going on that make 2026 something that I would like to get off this ride. But you know what? Here we are. And we're going to be here for you. And we're going to bring that hope and we're going to make this place a better place. So that's me because I don't have my Elizabeth with me. So that's what I just wanted to kind of get off my chest today. Hope you all listened just to the end. And we'll be back next week and reach out to us through any way you can. Through Instagram, through our email. We're here for listening. Bye.